Hi everyone, and welcome. Let's imagine a typical day in your life. You receive a call from your friend informing you about their recent hospital visit. Your friend went to the doctor for indigestion, but the reports showed that he had suffered a heart attack a few weeks earlier. You're taken aback and wondering what could have caused this. Surprisingly, your body gives you subtle hints before a silent heart attack occurs. We'll delve into these signs and more. Most films depict heart attacks as dramatic events where the person clutches their chest tightly, gasps for air, or loses consciousness. However, this is not always the case. A silent heart attack can have little to no symptoms. Medical professionals refer to it as silent myocardial ischemia, and it's hard to believe that such a significant event can happen without you even realizing it. The symptoms are often so subtle that they can be mistaken for a less serious condition. But what causes this type of heart attack? Your heart requires oxygen-rich blood to function properly. The accumulation of cholesterol-rich plaque in your coronary arteries can cause a blood clot to form, which may obstruct blood flow. Without sufficient oxygen, your heart muscles can't perform optimally and lose their ability to pump blood, leading to a silent heart attack. Type 2 diabetes is a significant factor for this type of heart attack, but there are other factors that may be beyond your control, such as family history of heart disease or experiencing preeclampsia during pregnancy. Additionally, being a postmenopausal woman over the age of 55 or a man over the age of 45 can increase your risk of heart attack. But how do you recognize a silent heart attack? There are various locations where pain may manifest during a silent heart attack, such as the center of the chest, right hand, jaw, teeth, abdomen, and even the back. This back pain differs from the discomfort experienced after sitting for an extended period of time and is known as angina pectoris. These symptoms may be difficult to identify, but your body will alert you when something feels different. Atypical symptoms may or may not be accompanied by chest pain. Feeling exhausted should not be dismissed as insignificant, as it could indicate a silent heart attack. This tiredness is different from the fatigue that you feel after working overtime or exercising excessively. It may also be accompanied by dizziness and difficulty breathing. If you experience any of these symptoms, it is best to seek medical attention immediately. Your doctor will run a few tests such as an electrocardiogram or MRI, which are considered the gold standard for detecting a heart attack. Blood tests can also detect messengers sent by your heart to your bloodstream before and after a silent heart attack. The length of time that a heart attack can last can vary from person to person. Typically, it lasts between 15 to 30 minutes, but anything beyond can result in irreversible heart damage. In certain cases, a heart attack can cause the heart to lose its regular rhythm, leading to a condition known as cardiac arrhythmia. Additionally, long-term effects of a heart attack can increase the likelihood of experiencing a stroke later in life. Are you looking to reduce your risk of experiencing a silent heart attack? Consider making some healthy lifestyle changes. Starting an exercise routine is a great way to start, even if it's just walking around. Gradually increase your activity level to brisk walking, jogging, or even trying out yoga or meditation. Mix things up with other forms of exercise such as aerobics, dance, or Zumba, and don't forget to incorporate some resistance training as well. Focus on eating nutrient-dense and high-fiber foods, particularly raw vegetables, which can help to maintain heart health. Regularly consuming omega-3 rich foods like salmon, avocado, and walnuts can also be beneficial. Say no to unnecessary snacking and sweets. Have a piece of fruit when you have a sweet craving. It will help you manage your blood glucose better. Also, quit tobacco. Our aim here is to get maximum oxygenated blood running through your system, and smoking clearly won't help. How often do you get regular heart checkups? Let us know in the comments below.